Welcome, everybody. I think we're going to get started. So I want to thank everybody for being here at the 19th Annual Microcurrent Conference. Woo, hard to believe, right? So this year, we are incredibly, really blessed to have Dr. Ed Kondrot return. Some of you guys actually don't realize that I had inherited this conference from Dr. Ed 9 years ago. It makes me kind of teary, right? So it is hard to believe. So none of this would have actually happened if it hadn't been for the amazing work that Dr. Ed Kondrot had done to bring this conference and this work forward. Now, I remember having been doing this stuff since, 2005. Oh my gosh, 20 years, right? I remember when a lot of this started, and it was very forward thinking, right? I mean, he really kind of blazed some trails, and he really made this, I think, to me, a unique experience in that it was always inclusive. It was always welcoming. It was always about building a community of people dedicated to bringing microcurrent work forward, not with one model, but with, looking at everything and welcoming everybody, whether you're a push and go user, whether you're an eye specialist, whether you're a physical therapist or a naturopath. He opened the door for everybody. So we will be eternally grateful. I will let him I think a lot of it, he's going to tell us about all the amazing things he's been doing. So I don't want to steal his thunder, but I'm very proud to give the floor to Dr. Edward Kondrot.
I think I got it. You can hear me okay? Well, it's a real honor to be here. Brings back a lot of memories from 19 years ago when we started the first microcurrent case conference. So I want to share with you kind of my journey from 1989 when I was first introduced to microcurrent. And I really want to thank Vanessa and Ning, because it takes a lot of work to put this conference together, a lot of work. You don't realize that until you're behind the scenes. So congratulations for Vanessa for continuing this conference over the last 9 years. And looking forward for the next 20 years, right? Yeah. Now, today is a special occasion for me. It's my 15th year wedding anniversary. So I said, honey, I got something special for you. I'm going to speak at the microcurrent conference. But being married to me for 15 years is like 95, because 1 year with me is like a dog year, 7 years. So people ask us, how long will we be married? 95 years. I think Lee will agree with me on that. So I'm going to take you on a journey. It's going to go through 3 continents and 4 states over the last 20 some years. And this is kind of my journey with microcurrent. Okay, how do we? This changes? Yeah. So we're going to begin by talking about the early years, and then the Pittsburgh years, the beginning. That's when I was a active traditional ophthalmologist when I first was introduced to microcurrent. Then we'll talk about the Phoenix years. That's when I began the development of specific frequencies for the treatment of the eye. And then the Florida years, that's when I developed actual specific protocols, which was a very exciting time that I want to share with you. Then the California years, where I'm located right now, this is the post-COVID era, making changes in the way that I practice medicine. And then we're going to talk about the successive treatments, some studies that were published, the future, and I'd like to give some advice to all the practitioners. And then also, I know all of you always like frequencies. What are some good frequencies for the eye? I want to share with you my special protocol that I attach to every eye treatment that I do. I call it my vision protocol. And I researched these frequencies over the last 20 years. and they're kind of unique. Some of them I got from, well, I'll go into detail about that. And also we have some advice for practitioners and questions and answers. So let's move on. Nope, it doesn't work here. This is forward. I want to go to the 4 phases. Okay. Okay, all right. I'm also going to talk about the 4 phases, and I categorize this in terms of my evolution of using microcurrent. The first phase was the use of a 1-channel delivery system and only using 4 basic Auger frequencies. The second phase was beginning to use the transpalpebral approach, using the same frequencies, but they were used through a electroconductive glove and also electroconductive glasses. The third phase was the introduction of actual customized frequency pairs. And the fourth phase is actually specific biomodulating frequencies and identifying physiological and biochemical effects that they have on tissue. The early history of microcurrent goes back to the ancient Egyptians, when there were stone carvings of a catfish found in hieroglyphics that produced an electric current. And the Roman physician Scorbonius Largus commented on this in 46 AD. So the early use of microcurrent goes back, But it wasn't until 1745 that a system was developed in terms of capturing the current. And this was the Leyden jar in 1745. And this was primarily used for the treatment of pain. The Electreat in 1919 was the first patented device, and it sold for $12.50. And this was actually the precursor of the modern transcutaneous electrical nerve stimulation, or the TENS unit. And this device is actually the prototype for the microcurrent stimulation unit that we're using today. And here's some literature that was on the market at that time for this particular device. Now, I began to look at the early history of the use of microcurrent in the treatment of eye disease. And believe it or not, it goes back to 1803. Philip Franz von Walther published a textbook on the use of galvanic current in treatment of eye disease. They remember at this time, 1803 was prior to the development of the ophthalmoscope. So most of the eye doctors at that time did not recognize diseases internally in the eye. So they were primarily treating cataract, inflammation, ocular pain, etc. And I managed to get a copy of this book. And years ago, I did take German reading in college, but this is old German. So I'm going through it and looking at some of his cases, but it's really fascinating to read the work of this pioneer that he was doing in 1803. Later developments, Henry Dorr and Charles Michaels did some work with microcurrent. And this is a picture of Philip Franz von Walther, a German surgeon and ophthalmologist. And his book is Über die therapeutische Indikation und den Techniken der galvanischen Operation. And this addressed the therapeutic indications and technical details of galvanic operations in ophthalmology, 1803. And here's a copy of the book. And here's one of the illustrations in his book, and you can see that he's applying these electrodes underneath the eye, and there's also a band on the head and some of the instruments that he used. Now, Henry Dorr experimented with electrical stimulation for treating specific eye diseases, retinochoroiditis, glaucoma, amblyopic, and optic atrophy. And he really did some of the groundwork on using galvanic stimulation in treating these diseases. And you have to remember at this time, in 1873, there really wasn't any pharmaceutical eye drops. Surgery wasn't really developed. So this was truly an advance in ophthalmology at that time to use a mechanism to help restore vision and treat these ocular conditions. Charles Michael in 1869 used a battery-powered needle epilator to treat trichiasis, and that's a condition where you get eyelashes that grow into the eye. They can stretch the cornea. It's rather painful. And he was, I guess, the pioneer to develop electrolysis, galvanic electrolysis to destroy these eyelashes that were growing improperly. In fact, we use this technique even today. People that have ingrown eyelashes will use electrolysis to destroy these eyelashes. Now, I was in the process of, we'll save questions to the end. I was in the process of writing my book called Homeopathic Ophthalmology, the use of homeopathy in ophthalmology. And I decided to go into the early modalities that ophthalmologists were using. And I was really surprised that in the 1900s, many ophthalmologists were using microcurrent along with homeopathic medication. And this article was published, Dr. Rufus King, Indications for Electricity in Diseases of the Eye. And this was the Transactions of the American Homeopathic Ophthalmological, Otologic, and Laryngological Society in 1903. And this is a quote from his article. In affections of the ocular muscle, I find electricity to play a highly important part. In fact, I scarcely know how to get along without it in many cases of insufficiency in coordination. This particularly applies to those cases where there is scarcely enough deviation to be an operative procedure, yet producing marked reflexive symptoms and much discomfort. It's useful in cases of those sufferers who, through fair diversion of the knife, decline surgical relief. Here, it frequently is not possible to effect a radical cure of the heterophoria, that's just a deviation, and much relief of the distressing symptoms usually follows the proper use of electricity, especially when associated with more recent methods of direct muscle massage. And this kind of got me thinking that I've had a couple of cases of crossed eyes or wall-eyed, and I have used microcurrent in these cases, and it has helped. And it kind of surprises me that more eye doctors are not looking at this modality to help improve binocular function instead of immediately going to surgery. In diseases of the choroid, and more especially for the result of such disease, I've utilized this method of treatment a little, and I think in several instances, especially in choroiditis diffusa, I've seen the progress of the disease promptly cease under application. And in several cases, quite a little improvement in vision, which followed its steady, persistent use. This improvement was not only manifest from the patient's improvement of visual power, but ophthalmoscope revealed decided changes in the appearance of the choroid. So this is phenomenal too, because as an ophthalmologist, we see a lot of choroid diseases and inflammation, and there really aren't any really good treatments. I just recently had a case of a patient from India who had a chorioretinal scar, and part of the testing we usually do is to see if they have TB, and he did indeed have active TB. And unfortunately, over the past month, He lost all his vision in the eye from active TB. And the only treatment was to actually treat the tuberculosis. But I think he would probably be a really good candidate for the use of microcurrent. But I was in a situation where I really couldn't offer him microcurrent because I still do some work with traditional ophthalmology, and microcurrent isn't widely accepted. And if I even mention it, there's a chance I could lose my medical license. So that's the problem that we're all faced with, is getting this information out there and have it more widely accepted by the ophthalmic community. But the shocking thing is there's a strong history. This is not a new treatment for eye disease. You know, it's been going on since the early 1800s. Retinitis pigmentosa. Personally, I've seen a lot of benefit in patients with retinitis pigmentosa. This is a progressive disease where you lose your peripheral vision. There's different hereditary patterns, but it's a devastating disease because you essentially lose all your peripheral vision and you're left with like looking through a small island of vision in the center. And I think just about every patient I've treated with retinitis pigmentosa has had an improvement of their vision. Not reverse of the disease, but an improvement of their peripheral vision. And I'll show you some of those cases later on. But he talks about here that retinitis pigmentosa, it has materially assisted in homeopathic remedies, not only in retarding the degenerative changes where it has been a potent means of improving vision to some extent. In the case of two patients whom I've been able to watch for the past 15 years, and I've seen grow from childhood to young man and womanhood, not only regaining, but gaining in vision ability as well as the extent of field of vision is measured once or twice a year by means of a perimeter. I've had them maintain practically the daily application of galvanic current in their home in West Virginia. In addition, have through part of each year maintained a line of therapeutic care by the use of apparently proper homeopathic remedies. And this is also my interest. In my practice, I typically use homeopathic remedies along with the microcurrent. And I think there may be a synergistic effect using these two modalities. Because remember, homeopathy is a frequency type of medicine too. We're trying to match the frequency of the homeopathic remedy to the patient. When we get the right frequency of the microcurrent, it can have a wonderful synergistic effect. So he goes on, the boy, now a man of 28, can now tell time by his watch in the moonlight, which is amazing because retinitis pigmentosa, they lose their vision at night. One of the first symptoms is their vision declines dramatically at night. A thing he never remembers that he was able to do before the treatment. Some years ago, he sent me a large wild turkey, which had fallen witness to his gun prowess. Good point. The guy's a hunter now. History of the disease now point to many cases of even partial improvement. I'm sure that the care of watchful and intelligent parents, together with the constant and intelligent application of electricity, has done much to maintain these individuals as useful members of the community. One of the saddest things in ophthalmology, typically when an ophthalmologist will see a patient with retinitis pigmentosa, nothing can be done. Contact the school for the blind, begin to learn Braille. I mean, they take away their hope. And there is strong evidence that microcurrent, other modalities can help these people. In cases of hemorrhage into the retina, I invariably use the galvanic current in conjunction with other appropriate treatment to aid in promoting absorption of the clot. And I'm convinced by my experience that it has expedited such absorption and hastened the amount of recovery that has been required in each case. And this is a very, very important modality for me. Onset of hemorrhage in the eye, especially in diabetes, when I think traditional medicine now is using very toxic agents, intravitreal injections that may have some short-term benefit, but I think long-term benefits may be detrimental to the eye. Certainly microcurrent in combination with homeopathic remedy can be very beneficial. Optic nerve disease. And this is a really big, important topic now because I'm seeing more and more cases of glaucoma. Glaucoma is a condition where you have damage to the optic nerve because of increased pressure in the eye. Typically, the traditional eye doctor really doesn't recommend anything to the patient in terms of improving the health of the optic nerve. All they are focused on is lowering the intraocular pressure in an attempt to help improve the circulation of the optic nerve. But in reality, I think we should do every modality possible to help improve the circulation of the optic nerve. And we know that microcurrent can do that. Microcurrent does improve circulation, reduces inflammation, can help improve oxygenation. So this is a modality that I encourage all of my glaucoma patients to consider to help preserve that optic nerve. So in optic nerve disease, especially in hemorrhage of the nerve, retrobulbar neuritis, and early stages of optic neuritis, I'm equally convinced that the use of constant galvanic current has aided me in either improving the condition or retarding the progress of the unimproved cases quite a bit. It would be ridiculous for me to claim any benefits from a use in advanced cases of optic nerve atrophy. It will no more restore the nerve to life and function activity when it will restore life itself in the moribund. So he's saying that if the nerve is dead, you're not going to bring life back. But we are mainly looking at cases where the nerve is sick, or there's a decrease in circulation, or there's a beginning loss of function. That is where microcurrent can have a tremendous benefit. Here's some other articles that were published in the journal. A case of optic atrophy, and he used strychna phosphorica 6X, that was the homeopathic remedy, along with galvanic electricity. And the placement was one pole on the eyes, the other on the neck, 3 times a week. And the vision slowly improved to 10/20. So that's probably 3 lines on the bottom of the eye chart, or 10/20 is vision good enough to drive in any state. And there's a case here of lachesis, which is a common homeopathic remedy used to treat retinal hemorrhage. Mrs. V, have treated her for over 12 years, occasionally acute attacks of hemorrhagic retinitis with complete scotoma. Complete scotoma is a big blind spot where they don't have any vision. This has always yielded in time to remedies and local galvanic electricity, and later to pneumomassage. So I just want to briefly mention the difference between galvanic and faradic frequencies in microcurrent. And this is a chart here. You can see the galvanic, it's a direct current, and it's interrupted, long duration, 100 milliseconds. Frequency is 30 per minute. Can produce contraction of the innervated muscle, and it's commonly used to stimulate small muscles. Faradic is also a direct current, shorter duration of 0.1 to 1 millisecond, 50 to 100 hertz, cannot produce contraction of the innervated muscle, commonly used to stimulate large muscles. And then the FSM, which we are more familiar with, is an alternating current, continuous application of alternating current, 10 to 60 minutes, and our frequency range is much greater, cannot produce contraction of the innervated muscles because of the low current, and it reduces inflammation, improves circulation, stimulates mitochondrial activity, and stem cells. So this is an important study that you're all familiar with, where Cheng actually looked at the effect of microcurrent on cellular activity. And he noted that between 50 and 500 microamps, there was an increase in ATP by 300 to 500%, and also an increase in protein synthesis and glucogenesis. The important takeaway from this is we want to avoid going higher than 500 microamps. And early on in my practice, when I first started, I was using 400 microamps. I wanted to be safe. And the beautiful thing about the Inspirastar and many other machines, they are current-controlled machines. So when we program it for a specific frequency or a specific current, it's not going to get any higher than that. The problem with the early machines, like the Microstim 100 and some of the early models, they were current adjust machines. We always told the patient, turn it up until you feel something and then turn it back down. The problem is most people feel that more is better. I want to get my vision better, and they would turn the current up high. And when you get above 500 microamps, there's a danger. And I've seen actually a decrease in vision, more inflammation, increase in intraocular pressure. So you have to be careful. Now, the interesting thing is, over the last 15 years that I've been doing microcurrent, talking to different practitioners, especially practitioners that are doing treating neuropathy, the feedback I got was, I'm using a lower current. I'm using 100 microamps, 80, 60. So over the last 15 years, I've decreased my current. Now I'm currently using 20 microamps, and I'm getting my best results. And I talked with Ning. I said, Ning, is it possible to adjust the machine that we could maybe get 10 microamps? And Ning said it could be possible, but it'll probably triple the price of the machine, right? The technology. So the takeaway point is, if you are doing any type of microcurrent, especially on the eye and neurological tissue, be careful. Don't use that high current. Use a low current. All right, let's begin my journey. The Pittsburgh years. That's when I had a very big ophthalmology practice. I felt there wasn't one eye disease that I could not treat surgically. I had my surgical center, cataract, glaucoma, corneal transplants. When I looked at somebody, I said in my mind, what surgical procedure could help this person? It was in 1998. There was a radio show, Paul Harvey. And on his radio show, he talked about Sam Snead. He said, slamming Sam Snead is back golfing now. His macular degeneration was cured with microcurrent. And at that time, I was seeing a lot of microcurrent, or not microcurrent, macular degeneration patients that would break my heart. There really wasn't anything I could tell them to do. Yeah, take some vitamins and, but it broke my heart. There wasn't anything to do. So when I first heard this, I gave Joel Rawson a call. He was the developer of the Microstim 100. And I said, Joel, I'm interested in using the machine. And at that time, it was a small, I'll show you a picture of it. And I ordered 10 of them. And I recruited 10 of my patients who were suffering from macular degeneration. And I said, let's give this a try. And I treated them for a couple of month period. And lo and behold, 8 out of 10 had a significant improvement on vision. So I was really convinced that this modality definitely would have a positive effect. Now, it's interesting because when I first got the microcurrent device, being a good physician, before I treated a patient, I wanted to treat my own eyes to see what would happen. I mean, I had no idea about the current, what would it feel like? And I can still remember this day. I'm sitting in my office, the door's closed, turning on the machine. And as it touched my eye, the first image that came to my mind was the front headline of the Pittsburgh Press, local ophthalmologist blinded by microcurrent. That was the thought. So I treated my eye and then, blinked a couple of times and, it was probably a placebo effect that I thought the vision was a little bit better. I'm going to talk a little bit about Grace Halloran, amazing individual. I think she was the true pioneer. In fact, I dedicated my book, Microcurrent Stimulation Miracle Eye Cure, to Grace. I'll talk you through a little bit about her. My microcurrent book, my visit to the FDA. Yes, I went to Washington, D.C. and sat down in front of the big committee of all the top wigs to try to get them convinced that I could even start a study with microcurrent. That was interesting. And my first exposure to Jim Suzuki, who a brilliant electrical engineer from Seattle, who gave me a lot of important information and helped me develop the second phase of my microcurrent treatment. Uh-oh. We lost it, man. Let's see. And this is Paul Harvey's. And now the rest of the story. So he was instrumental in putting that thought of microcurrent in my head. And here's Sam Snead, a great golfer. Joel Rawson, the developer of the MicroStim 100, very interesting. After graduating veterinary medicine, he began a study group at UCLA where various doctors were looking at the use of microcurrent. And he initially opened an animal practice for 7 years. And then he left that practice to market and develop his MicroStim instrument. And this was in conjunction with Grace Halloran. Grace worked as an athletic trainer at Petaluma High School. And she was using microcurrent for various sports injuries. And when the doctor diagnosed that she had retinitis pigmentosa, and he told her there was no hope, no cure, she thought, well, you know, microcurrent was helping all these inflammatory ailments with athletes and was helping their muscles regenerate, reducing inflammation. And retinitis pigmentosa is an inflammatory disease. Maybe I could start using it on my eye. So she began using it on her eye and had a dramatic improvement of vision. So this is probably the first documented case of the use of microcurrent, at least in the 20th century, where she opened a clinic using microcurrent and different light therapy modalities to help people regain lost vision. And Grace and I became friends, and we actually did several talks together in clinics, and I was part of her clinic, and I'm really grateful to her. She helped motivate me to understand the power of microcurrent. Okay. Then I had the opportunity actually to treat Sam Snead. This was, I met Sam Snead's physician, and he invited me to Florida to treat Sam. And in return, Sam Snead gave me golf lessons for a week. So I treated Sam with microcurrent for a week, and he gave me golf lessons. And this was all monitored by Sam's physician, and we did before and after, and he did have an improvement of his vision. Not significant, but a slight improvement, because at that time I saw him, his condition was pretty far advanced. But the most interesting part about this week trip, I had several meetings with Sam Snead's business manager, and he had documents set up. They wanted to start Sam Snead macular degeneration clinics. He wanted to bring the marketing to the masses with microcurrent. And I wish I kept those proposals, because he gave me a proposal and we were reviewing it. And then we were all set to sign on a dotted line, but then there became issues with the FDA. So the whole project was dropped. But everybody wants to know, did Sam Snead help you with your golf game? And after watching me hit a couple buckets of balls, Sam put his arm around me and says, Dr. Kondrot, here's what I want you to do. I want you to cut back for a year and then just give up the game. But interestingly, I did give up the game for about a year. I was just so busy with microcurrent and other things. I never golfed. So indirectly, I did listen to Sam. But did you know that Sam Snead hit a hole-in-one with every club in his bag except his putter? I mean, that's phenomenal. You know, most pro golfers maybe have one or two hole-in-ones. So he had 14 hole-in-ones with every club in his bag except the putter. So I said to Sam, when did you get a hole-in-one with your driver? He says, well, it was Pebble Beach, number 17. He said, most of the boys couldn't even make the green. And I knew I hit a good shot when I saw all the hats fly up around the green. So that was his hole-in-one. And 17's a par 3 at Pebble Beach. And when the wind's blowing in your face, you don't get much distance on the tee shot. Now, I still have nightmares about this. The visit to the FDA. I went there with Joel Rawson. We sat down with the committee, and it was the most ridiculous meeting in the world. I did present some data, and what they wanted me to do is, before they would give me approval, they wanted me to do an animal study on the safety of microcurrent. So I was very polite, and I said, well, what animal study would you like me to do? And they says, well, that's up to you to do the research. So it was just a lot of run and delay. But at that time, in fact, Ning and I, we wanted to do a controlled study with the microcurrent, and we had developed a machine where the patient and the doctor would know if you were actively getting treatment. So everything would run on the machine, but the lights would come on. We didn't know if the current was active or not. So it was really a good controlled study. Me as the practitioner wouldn't know. The patient wouldn't know. We just ran the program and tested vision before and after. So I was really excited about that study because this certainly would convince people, using a controlled study like this. But I got a letter from the FDA, cease and desist, can't do it. So that study was aborted, which was really disappointing because Ning put a lot of work into that. Remember all those machines that we made? So if any of you have an Instar machine that doesn't work, it could be one of the machines that you didn't sell them to people, did you, Ning? Okay, phase one. This was a single channel machine that only had 4 fixed frequencies. And I believe that this is based on the work of Dr. Noget. He was a auricular therapist, and he felt that the higher frequencies, the 292 and 30 hertz, reduced the inflammation. And then the 9.1 and 0.3 hertz helped healing. And so our treatment protocols consisted of doing 292 and 30, running those for a couple of minutes, and then doing the lower frequencies. And these frequencies were applied. This is the device here, the micro stem. And it was we put a cotton tip applicator in the tip. And these were the settings. This machine was kind of tedious to do because you had to put the switches on the right frequency, and then you actually had to time it. There wasn't a timer. You roughly did it about 15 seconds. So we had 8 points, 4 different frequencies, and you can imagine how tedious. Plus these patients had poor vision to begin with, and they're trying to find a point on their eye. So these were the 8 points that we used. And this was an illustration to help guide patients on the treatments. Now, one thing that convinced me the power of microcurrent, right around this time, my son, Sean, thought he was Peter Pan. He jumped out of a tree and landed on his wrist and broke his pisiform bone. And this is a small bone that doesn't have any circulation. And the doctors felt, well, they were going to put a temporary cast on him. If it didn't heal, they'd have to do an open reduction. And it's rather serious. They have to make a big incision to reposition the bone. But I said to Sean, here's what I want you to do. I gave him a microcurrent machine, run these frequencies every day. And then when he went back to the doctors were surprised. They couldn't believe that this had healed. So the results of phase one. Dr. Jarding, who's an optometrist from South Dakota, he was the one that originally treated Sam Snead. And he presented data on 400 eyes treated with the Noget frequencies. Larry Wallace, who's been a speaker quite frequently here at the Microcurrent Case Conference, also presented data on 43 patients with improvement. 54% of the improvement had an improvement of 1 to 4 lines, 31% 2 to 4 lines, and also visual field, Humphrey visual field improvement. And Dr. Wallace actually holds one of the first patents for the microcurrent device. His company was SciFix, and they currently were trying to get funding to get FDA approval, but they ran into difficulty. And that's one of the biggest issues that I have found. There's a lot of really good companies, but it's just impossible to get FDA approval. And the problem is that the FDA really has no business, I think, approving devices for specific therapies. Their main goal is to approve devices for safety. It's up to the physician to determine the use of that device. And that's, I think, a big mistake, because the only people that have the money to do these studies are big pharma. And then half the members of the FDA are ex-officials for different pharmaceutical companies. So it's a vicious circle. And they really don't want microcurrent to be approved. I think microcurrent has the potential, I feel, to actually replace the pharmaceutical industry. Dr. Damon Miller, a naturopathic doctor from Washington. He's also published some studies. And this is my book that I wrote in 2000, Microcurrent Stimulation Miracle Eye Cure. And the book was dedicated to Grace Halloran, forward by Dr. Damon Miller. And these are some of the chapters.
Tell me when we're ready to go.
Why doesn't my doctor know about microcurrent? There is hope, Grace Halloran's story, history of microcurrent. So this book is a good introduction to the early history. In 2002, I presented some of my data from my initial treatment using phase 1. This was published in the Tanzan letter. And percent of eyes with improvement of acuity about 66%. And this is pretty consistent with other doctors that have published data, Dr. Jardine, Dr. Wallace. Range of improvement 0 to 2.5 lines of vision. A line. And there was one patient here who had a dramatic improvement of the retinal lesion. You can see the elevation right there. And then after treatment, there was a complete resolution. So phase 1 was very, very exciting. That was my introduction. Then we go to phase 2. I was looking for an alternative treatment device, and I met Dr. Jim Suzuki, and I worked with him. We wanted to develop an automated system. Remember, initially in phase 1, the patient had to change each of the frequencies tediously and actually time 15 seconds, 1001, 1002. And it was poor compliance. These are elderly people. Imagine going through all these different steps. So Dr. Jim Suzuki helped me develop a automated protocol. So you could do these treatments and it would sequence all of them going into the eye. And then we decided to use microcurrent glasses or a mesh. So this was a transpalpebral approach using the same frequencies, but they were automated. The other idea he had was, why don't we have 2 channels? So we were running the same frequency, but we were offsetting the frequency. So instead of running 30 in both channels, one would be 30, one would be 30.2 or 30.3. So we thought these offsetted frequencies would give a resonance and would get a more specific distribution of frequency. We're assuming, and that's one of the biggest mistakes we have. We assume that when we turn that dial to 30, we're actually getting 30. And I know there tends to be a drift, especially with the analog machines. The old blue box, there's a drift with that. You may think you're getting 30, but actually you may be getting 32, 33. There's a drift. And even the manufacturer recommends that it's calibrated every year to make sure that the frequencies are on. But I think the digital is much more accurate. It's pretty precise. When we program a certain frequency, we're getting that frequency. But there's a whole nother discussion, which is better, analog or digital? Because I do think the analog, you get a much purer frequency. The digital is little packets of information. Now people are going back to the old LPs, the real music files, like the old LPs. There's a more pure music to it than the digital. So if you really have a good ear. So my question is, maybe the analog machines would be much better than the digital ones. But anyway, there was two big improvements. One, we were using a paired frequency with an offset, and it was automated. So this was the machine that we were using. And initially, it would run through these whole frequency patterns. The patient would just hold it there. And it would go through all 4 frequencies, and they would do, different locations. Then we developed the microstim glasses, which nothing but trouble. And there were problems with them. Jim Suzuki was personally manufacturing each pair of them. And they were just really weren't reliable. And then I got a problem with the FDA. I mean, first of all, microcurrent, they advised not to use it on the eye. And here I am using microcurrent glasses to deliver it. So I got in trouble with the FDA, and we had to abandon that. But the brilliant idea was the pinhole glasses, because the pinhole glasses were such that you could wear the glasses and still be able to function. But I think that there's a disadvantage. When people do the eye program, I want them to relax. I want them to close their eyes and meditate and visualize. I think a lot of it with microcurrent is the intention of the practitioner and the intention of the patient. So the more active you are with the patient, I think the better results. I think somehow your energetically, is going into these microcurrent frequencies. So if you have a passion for what you're doing, you're going to get better results. And also, if the patient is focused on healing, visualization, they're going to get better results. I think that's a mystery of the higher energy that we're doing, because it is, the microcurrent is a carrier, and it's carrying energy, our emotions to the patient. Here's an example of the glasses. So that was phase 2. Then phase 3, now we're moving to Phoenix, Arizona. No, I remember. We got to do something. Hello, the canyon, Grand Canyon. Hello. Hello. We're in Arizona. That's why it happened. I remember I got a phone call from Carol McMakin. And she said, I heard you're using microcurrent on the eye. I never heard of her before. And she started telling me about, we got some frequencies that help. And I really give her a lot of credit, because I took all of her training, and she really helped introduce me to this whole idea of frequency specific. So in Phoenix, it was probably the most exciting time of my life, because I was doing frequency exploration. What would be the best frequencies for the eye? I abandoned those J frequencies. This whole world of multiple frequencies opened up. I was like a kid in a candy store. And I really have to thank Dr. Carol McMakin for making that phone call and telling me, we have certain frequencies. And of course, the frequencies go back to Albert Abrams. And one of my, Dr. Charles McWilliams, he's the one that really compiled a lot of these frequencies. And you can get a hold of his book, Radiotherapy and Electroacupuncture. And the frequency pairs that I'm going to be sharing with you for vision are from Dr. Charles McMakin and others that I've compilated. I'll give you those frequency pairs at the end. And this is some of the chapters here. And we all know this, frequency for the retina, the macula. But the question I have is, okay, they say the retina's frequency is 95. Is it 95? And I began looking, the retina has 10 layers. And then my idea was, well, maybe it's 95 for the whole retina. Maybe it's 95.5 for the choroid. Maybe for the retinal pigment epithelium. There's 10 layers. So my question was, why is this frequency? So the beautiful thing about my days in Phoenix, I had an active clinic. I had 3 microcurrent technicians working for me. So each room had a blue box. I would sit down with the patient. Okay, what disease did they have? What frequency possibly, or what pathology was going on? Like for glaucoma, elevated pressure. Maybe it's a problem with the ciliary body, maybe the trabeculum, maybe the optic nerve. So I began thinking, and then what pathological frequency. So I would have like a yellow legal pad, and I'd write everything up, give it to the technician, they'd go in and do all the treatments, then I'd evaluate the patient. So that was an exciting time because we were going through thousands of patients, multiple frequencies, and these people were there for a week. So I had a chance to really see what frequencies worked. Anybody here a ham radio operator? All right. KA1MD. How do you like that call sign? I'm an A1MD. But I kind of make the analogy like, Lee, if I wanted to talk to you, we would agree on a certain frequency, maybe 7.3, 40-meter band. We would tune in there, and then our voice would do the modulation. So microcurrent's kind of like that. We want to find a frequency of the tissue. We connect with the tissue, and then we send another modulated frequency to tell the tissue what to do. So in a way, it's kind of like the ham radio. We're communicating with the tissue. And these are some common frequencies there. So frequency exploration. So I would sit down, my yellow legal pad, selection of A frequencies, B frequencies, and then combine the frequencies. Then I would test the current, test the time, and I would evaluate the results. So thousands of patients over many years. And then we came up with these protocols. Now here's the problem. I'd come up with these beautiful protocols, maybe 30 frequency pairs that help the patient. What am I going to do? I can't send them home. I can't send them home with the blue box and tell them to run them. And I said, there has to be a way to make a programmable machine. That would be the secret. So I interviewed 3 electrical engineering companies, and all of them wanted, $30,000, $40,000 retainer. They couldn't promise me any results. And I was really frustrated. So I decided to enroll in the mechanical engineering program at Arizona State. And I can remember my first class, advanced digital circuitry. I'll tell you what, I have a lot more respect for electrical engineers after that. I was given a homework assignment. I had no idea how to even start. But it was there when I met this guy, Ning Wu. I call him Ning Wow. And I don't know why, Ning, why were you interested in helping me? But Ning became really fascinated because he didn't realize that microcurrent could actually help people suffering from vision problems. So he had a lot of passion. And I can remember all the meetings he had developing. I think your team in Canada worked on it. But it was a matter of a couple of months, you developed the first programmable machine. And it really changed my life because now I would have these beautiful frequency pairs that work with patients. And at the end of the week, I couldn't send them home. I would give them a generic microcurrent machine and say, well, just use this to, maintain. Then it'd come back but now it was beautiful. I could program these frequency pairs into a machine. They could take them home and do the treatments every day. So phase 3 was a significant advance when we were able to make these protocols. And then I developed, this is an example of a knee protocol, but you know what I'm talking about, but the machine programmable. This is the machine here. The other thing we decided to do is develop the machine so a person with low vision could use the machine. I know there's a lot of machines out there that have the digital display, but if you have macular degeneration and you're losing your vision, you have poor contrast, forget it. You're not going to use that machine. But this machine, the buttons are elevated, they can feel it, almost like Braille, and they can run the machine. So this is an unbelievable model, especially for eye patients. Then around that time, I was so excited with the technology. I met Darren Starwin and other people. We decided we got to bring the community together. And we wanted to have a community non-biased. We're not emphasizing one machine. We want a community to come together, different machines, different techniques, to share our experiences with microcurrent. And that became the first annual Microcurrent Case Conference in Tempe. And Dr. Wallace spoke there, Nori Kohler, Richard Lukenga, Painful New About. So it was a great meeting, you know, diverse practitioners. And then we also, at that time, I really had a lot of motivation. I wanted to make published proceedings of each microcurrent. So we did it for a while. And I think a lot of these proceedings are still available. Ning has copies of them. They're in the back. Oh, all right. Now, I want to have some fun. You know, microcurrent is more than the eye. And Lance Armstrong on the left, and we got two athletes on the right, my wife and I. We ran the Marine Corps Marathon, 26.2 miles, and you got some muscle soreness after the race. And we did a 30-minute application of the inflammation program, and the muscle pain just went away. I mean, it was like amazing. We also did the Maratona de Roma. And I have a strong attachment to Rome. My best friend's an ophthalmologist in Rome, Robert Staggerwald. And I was doing some research at the University of Rome. There was a professor there who felt that microcurrent could open up the communication channels at the cellular level between the nucleus, RNA, and DNA. And we started to do some research at the University of Rome, but we never really got into the actual study. And the problem with Italians like to meet, they like to eat, they like to talk, but they don't like to work. So we had many, many dinner meetings, many wine parties, and all kinds of exciting discussion, but nothing was accomplished. And I was really disappointed because I finally thought that we would get some international recognition with microcurrent. But I did become a member of the Italian Ophthalmology Society, and I did give a course on microcurrent to Italian ophthalmologists, and they are much more open. In fact, I published a chapter on vision rehabilitation on microcurrent in one of their textbooks written in Italian. So they are more open to alternative therapies. My wife and I, we did the 500-mile Camino de Santiago pilgrimage. It's a 500-mile walk. And believe you me, I carried my microcurrent machine with me. And a beautiful, beautiful, it was probably one of the best vacations we ever took in our life. And here, I developed plantar fasciitis. You know, I got really good boots when I started. By the end of the pilgrimage, I held the boot up and it was translucent. The bottom leather was translucent. I said, my God, that's why I got the plantar fasciitis. But every night I was treating that. Then I was doing inflammation on my whole body, holding the gloves, just running inflammation. So that probably helped me complete it. So here's, let's see if we can play this.
Because I thought this was voodoo medicine. I thought it won't help me anything.
Because you're a big guy.
But it does.
Right? Like 60-ish%?
60?
Come on, let's go.
I became very popular on the microcurrent. They said, "Who's that guy with that device?" Everyone's coming up to me, "Oh, my knee hurts." And so I was treating all these people. All right, now we go back to Florida. We started in Pennsylvania, Arizona, then Florida. I believe in synchronicity. And this was 2014, cover of the New York Times, May 25th, on my birthday. Is that a sign or not? Dealing with the body electric, how remarkable microcurrent is. So in Florida, we began actually running standardized protocols. And our goal was to find out what combination. We had good protocols for the eye, but how about other modalities. So I began looking at stress, detox, inflammation, brain, and sensory. I wanted to get a combination of protocols that I think would effectively help. And so very commonly we did stress and detox just by simply holding the gloves, or by doing the stress and detox on the abdomen like this. And the general rule for all of my patients, just draw an imaginary line from one glove to the other. Where that line crosses, that's the area where we want to do treatment. The other thing is I found that microcurrent can work in a hot tub. So just put the leads in there, really great for detox and inflammation. And this is a patient of mine.
Well, the last series of TIAs, I went to program 4 on the microcurrent machine, and that seemed to have prevented more than one. And this happened twice. And
So it wasn't a fluke. If it happened twice, then it's
it
pretty,
happened twice.
yeah.
And as regards cervical arthritis and the inflammation program, it relieved pain in a matter of.
The volume isn't coming, but he had these intermittent TIAs. And when he was doing the brain and sensory and inflammation, he was able to abort them. Before he did the program, he would actually get some paralysis. So he was using, I thought that was remarkable. I also did a lot of training in Puerto Rico. Puerto Rico, very, very open to microcurrent. This is one of the.
Hi, I'm Dr. Ada Ortiz Santiago. I'm a pediatrician, board certified. I'm also a naturopath, an acupuncturist, and a homeopath. I came here to see how the machine works in this bar, and it's wonderful. I suffer from a chronic MJ, and I have the neck problems and the tinnitus and everything. And also, I was forgetting things because I was so tired. I work in a hospital, and after 3 minutes of having it on here for the TMJ, and I put it in my brain, I remembered things I couldn't remember about 20 minutes ago. I kept remembering what's the name, and look at my mouth. I can finally open my mouth, which is usually cannot be done because the TMJ makes your temporomandibular joint inflamed. So I recommend highly this product for everybody. Thank you.
So typically now what my protocols are, we have an eye program, which is specific. And normally what I do is I review the eye records very meticulously to try to find out. I mean, there's many different types of dry macular, different types of wet, diabetes. I want to know where the inflammation is there hemorrhage, what's going on so I can get the right tissue frequencies. Then we have a basic detox or specific. You know, if they have elevated lead or mercury, then we want to focus on that, but the detox is important. Then I want to do some type of stress, either parasympathetic or sympathetic, depending on the disease. So if they have wet macular where there's a lot of inflammation, we want to do more of a parasympathetic stimulation, reduces stress. But if they have dry or optic atrophy or something like that, we want to put more energy in, we want to do the sympathetic. Then the brain and sensory is a really key. I find that using the brain and sensory along with the eye program gets the best results. Because you can't refract a 2400 brain to 2020. Now, if the brain is only seeing the big E, you can't get the eyes to see the bottom line. So stimulating the brain, and the feedback I get from my patients, it seems to be the combination of brain and sensory and the eye. They get the best results with their vision program. Then they have the option. My patients have the option to select 5 optional protocols, and we have a list of those. So here's an example here. Cystoid retinal edema and cataracts. This is an example of a typical protocol. Now it's really beneficial because most of my work is online, we have a setup now where I can change the protocols and frequencies online with the patient. I log on with TeamViewer using the software so I don't have to send the machine back to me. So these are some of the general protocols that you're all familiar with. And these have been developed during my years in Phoenix. I had several really good naturopathic doctors work in the practice. Dr. Fine worked in my practice. A lot of you know her. She was really big with microcurrent and facial rejuvenation. She helped me with a lot of these protocols. Dr. Meyer from Norway, she was an active part of the microcurrent conference. Naturopathic doctor worked it in. So I had some really good naturopathic doctors during those Phoenix years, perfecting all of these frequency pairs. And then these are some protocols for the eyes. These have evolved over the last 15 years, and they're constantly being changed, We're always tweaking them. Okay, now we go to the California years, post-COVID. I mean, COVID upset my practice because at that time, patients were coming to my practice for a week. We were treating them, running frequencies, and we had to get some type of method to help these people that were suffering. So we developed a home program, which has actually been very phenomenal, where I review their records. We have a comprehensive consultation with them. And then we program a 10 protocol microcurrent machine for them. Light therapy, we do a 6-hour urine test for heavy metals because I think heavy metals are a contributing factor in eye disease. If the lead's elevated or the mercury, we got to help address that too. And they meet every week with my program director. So all the patients get online if they have questions, because the big problem is telephone tag. They call the office, manager calls back, and so now we have a weekly meeting where all the patients get on if they have any questions. Then I meet with everybody twice a month, which is wonderful. And we discuss what's going on, problem, situation. That's my bi-monthly meeting. So I published the results. This was in alternative therapies of 290 patients treated using this protocol. And overall, 2 lines of improvement, 10 letters, which is significant. This is over 3 days, mind you. This isn't, just 3 days. 43 eyes, 15%. 1 line, 5 letters or more. So you can look at maybe close to 70% of people had 1 line or more improvement of vision over 3 days, which is kind of remarkable. And we also looked at contrast. And it was a significant contrast improvement. I'll show visual field expansion. Here's an example of somebody with a branch artery occlusion. After 3 days, resolution. I mean, this is unbelievable. You ask any ophthalmologist, can you get an improvement like that? They'll say, no, it's impossible. And this was a medical doctor, came in, advanced glaucoma, altitudinal field defect. After 3 days, gone. Amazing.
I'm Dr. Carol Benoit, neurologist, and I have just seen Dr. Edward Kondrot for the first time for devastating eye problems that have really put me under for the last month, especially rapidly worsening eye inflammation and tearing. My basic problem is glaucoma due to autoimmune eye disease called uveitis. And in the hands of 4 conventional ophthalmologists, of course, nothing gets better. I just add eye drops, which I'm rabidly allergic to at this point, and eye visits and costs. And he has significantly reduced the size of a blind spot in my left eye. I am just so thrilled about that. He's improved my visual acuity significantly, 3 lines on the eye chart. My contrast sensitivity is markedly improved.
and my comfort level is markedly improved. Every treatment seems to bring greater improvement for me. I've been most impressed with the reduction in my allergic symptoms with the cold laser, but everything helps. I love the microcurrent machine. It gets me more relaxed than anything that I have gone through. But basically, to see the improvement that I have just learned about today after this, my third day of treatment, is astonishing, with hope for further improvement in the future. God bless him. Thank God for bringing me here. Thank you.
There was another significant study by Lori Chaikin. I think she presented it here at the Microcurrent Case Conference using microcurrent and significant improvement. So the future, I mentioned phase 4 development. Now we're looking at frequencies affecting different tissue biomodulators. And this was spearheaded by Howard Leonhardt, who's an electrical engineer, a big California investor, developer. And Peter Wilcox back here is part of the team. He's doing a study. I think he's going to be talking this afternoon. But the interesting thing is we're actually looking at frequencies affecting certain tissues. And I'll talk about the Arnold-Schultz law. This brings back another thing that I mentioned earlier. Remember I mentioned the low current that you want to avoid over 500? Well, the Arnold-Schultz law, the low current stimulates, medium current stabilizes, and a high current suppresses. So a lot of these studies now have been done with very, very low current, but keep that in mind. You don't want a high current. You want to keep it low. And this is the dose dependency with electrical physical agents, both the Arnold-Schultz law and the Goldilocks principle. Goldilocks principle refers to the idea of finding just the right balance in various contexts. So the company that Howard Leonhardt set up is called iCell, and his goal is to bring microcurrent technology and make it FDA approved, make it available. And let's see here. And we have found different biomodulators. One is the VEGF protein expression, vascular endothelial growth factor. And this protein will stimulate the growth of certain tissues. And so he has identified certain frequencies that do that, stimulate the growth. The other one is SDF1, stem cell derivative factor. Certain frequencies that will stimulate stem cells. You know, there's so much talk about stem cell therapy, fetal tissue, placental stem cells in terms of regeneration. But you have to remember, our body has stem cells. When I cut my finger, I don't have to get stem cell transplants for my hand to heal. What we do need to do is to stimulate our existing stem cells to go into action. So to me, this is unbelievable that now we have certain frequencies that stimulate our body's existing stem cells to help regeneration. So I think this is huge. And Leonhardt and his group have actually identified in the laboratory, these frequencies that accomplish this. Clotho is another anti-aging protein, which we've identified certain frequencies that affect this. So a decrease in Clotho causes all of these problems. I mean, it's a myriad of problems, health issues. So somehow if we can increase Clotho, we're going to help. This probably could be the biggest anti-aging factor in our body. And, if we have methods of increasing this factor, phenomenal. And microcurrent can do this. I'm just going through this. Now, Leonhardt has done remarkable work. This is a device called MyoStim to help cardiac rehab. One of the biggest problems after somebody has coronary artery disease or a bypass or a stent, the heart has a little bit more irritability, atrial fibrillation. ventricular tachycardia in the myostem has been found to reduce this electrical abnormality and help people healing much better using certain microcurrent frequencies. We all know that wound healing is really big, and Leonhardt's working on that. Wound healing goes wireless with different applications. Cell migration, foot ulcers, we know all this. Bra cell, finally. He's actually working on this. And we know that the number one use of microcurrent is facial rejuvenation. So, advice for practitioners. Diagnosis is important. Know what you're treating. Somebody comes in, I got problems with my vision. You want to know what's going on. And probably the best way to do that is work with an eye doctor. There are many doctors out there. And I would go to the College of Syntonics. These are eye doctors that do microcurrent, do light therapy, work with that group. But you want to have a good diagnosis. You want to make sure you know what you're treating. Early on in my career, I insisted on doing an eye exam. And a lady came to me because she had cataracts. And I would not treat her unless I either examined her or got a copy of her records. When I examined her, she had a detached retina. Now, if I would have began treatment on her for a cataract, and she goes to an eye doctor, and that eye doctor, I guarantee he's going to say, Dr. Kondrot's microcurrent caused this detached retina. And then I got $1 million lawsuit. So you need a diagnosis. And I think you need to work. Eye problems are very tricky to treat and to manage. You need to, monitor pressures and all these things. And I'd be happy to work with you on all that, or other eye doctors. Low current. Don't jack up the current. Low current is where you want to be, and also time. So this is my frequencies. Write those down. Okay, good. Everybody got it? I hate when presenters do that. The most important slide and they flip. Okay, so here they are. And I don't want anybody to tell me, well, 42 doesn't make sense, Dr. Kondrot, because that's this. This vision protocol, every patient that I treat gets these frequencies as an add-on. So if I'm treating dry macular, and I use this as a protocol, somebody who's presbyopic or vision blurry, and went to their eye doctor, glasses don't help. This is, and give me some feedback on this, but I like this. Usually for 10 minutes. Oh no, 10 minutes for the whole thing. Never between 10 and 30 minutes. I used to run protocols for an hour, 2 hours. I've tried all the times, and to me, 30 minutes seems to be ideal. 30 minutes seems to be ideal. Well, it depends on if it helps them, then I don't have to repeat it again. Remember, microcurrent is to stimulate the body to heal. They're not to become dependent on microcurrent. I would say 20 to 40 microamps. Yeah, you definitely want to keep it low. Oh no, 10 minutes for the whole thing. So 1, 2, 3, 4, 5, 6. So that would be 1.5 minutes probably for each one. Okay, this is my website, healingtheeye.com. You can download my best-selling book for free. It's a free download. I have a chapter on microcurrent, homeopathy, light therapy. Oh, that's my old book. That was written in 2000. That's, yeah. But this is 10 Essentials. And it's a free download. Go to Kondrot book. That link may not work just yet. I have to update that link. But the best way to get the book is to go to healingtheeye.com. Tomorrow, that link will be active. So just go here and click on this. You can download the book. And I have a very active Substack account. Are you familiar with Substack? Substack's amazing. It's actually freedom of the press. And every day I try to publish an eye tip. And go to www.kondrot.com. You can sign up. It's free, but you can upgrade to become a subscriber. And 100% of all the subscriptions go to our mission work. So not only are you getting good eye information, you're supporting me on my mission work. And there is me in Togo, Africa, operating on a 5-year-old that was blind in both eyes from cataracts. And this was a trip in Ecuador that we did. We operated on about 300 blind people. So your subscription helps me on my mission. I do not do any eye surgery here in the US. Mainly, I'm trying to talk people into alternative treatments, how to get their body healthy, how to treat the underlying cause. But when you go to a third world country and people are lucky to get 1 meal a day, you can't talk to them about microcurrent, homeopathy, changing their diet. They are blind. I mean, you see 20 and 30-year-old young people totally blind with cataracts. And, just a 10 to 15-minute operation gives them back their sight and their life. So it's a completely different approach. We are very fortunate here that we can look at these things. And also, I am happy to do a record review, freeconsult.us. So if any of your patients have an eye problem, I will review their records for free and give them advice on the appropriate therapies. Okay, questions and answers. Yes.
Hi. If you know you have macular degeneration, the dry form, and you've had an ophthalmologist evaluation, but they don't do microcurrent treatment, how do you find a practitioner that's close to you or that would take you on to do the treatment or teach you?
Okay, number one, I would download my free book, because improving macular degeneration is more than microcurrent. Microcurrent should not be viewed as a quick fix. You got to do the basics. You got to look at your diet, nutrition, take care of other health issues. There are a lot of eye doctors doing microcurrent. Dr. Peter Wilcox. I would suggest going to this Syntonic website. You can Google Syntonic optometry, and they have a list of doctors who do microcurrent. And I have a home program. I treat people from all over the world. You would send me your records. I would give you a programmable machine. You'd become a patient of mine. So that's one way of doing it. That's kind of my business right now, taking care of people who are going blind, who their eye doctor told them nothing can be done. They find out about me. I do a record review. We have a telephone consult. I find out what your needs are, and I'll program a microcurrent machine specifically for you, not only for the eye, but for other modalities. And then we'll follow you over time to make sure you're hitting in the right direction. Yes, sir.
How do you deliver the frequencies? I saw a probe on one of the slides.
Oh, right now we're using a silver impregnated glove, and we wrap it in a washcloth.
Okay.
That seems to be the most economical and most effective way.
Okay.
Also the most cost-effective way. They do have electric glasses, but that's an added expense. And to me, they haven't been that reliable.
So on the glove, you just put it.
The glove, you wrap it in a washcloth,
And put it on.
put it over your eye.
Oh.
And the moisture, it gives good contact for a palpebral approach.
Gotcha. Have you ever tried the PEMF delivery?
PEMF you have to be careful with, because you really don't know the intensity. And I've used all of the PEMF machines. And I have found that the problem is you're delivering too high of an intensity to the eye. And I've seen intraocular pressure increases and decrease in vision. The PMF is great for the body, improving circulation, but you have to be very, very careful with the eye. I do not recommend it on the eye because I've seen pressure increases. Mainly, the beautiful thing about the microcurrent machine, we can control the current. The PEMF, you have a low intensity, but you have no idea what the pulse intensity is. And you really want to keep it at a low level.
Gotcha. Thank you very much.
Any suggestions for floaters?
Floaters, I think you have to really look at detoxifying the body. That's the big issue. And so I do have some good microcurrent protocols for floaters, and primarily they're based on detoxification. Something interesting, about the early years, I didn't mention this. When I was treating glaucoma, I did not have any success in like treating the nerve, treating the ciliary body. But then when I started doing brain frequencies, that's when I got the best success. So then I discovered that, hey, glaucoma is a disease of the neurological system, not so much the eye. And it's interesting now in the ophthalmic research, they're discovering that glaucoma is a disease of the neurological system, not the eye. So, microcurrent can also be used as a diagnostic tool. For example, those of you that are practitioners, you're treating the knee and you're running in different frequencies, and all of a sudden you use the cartilage and inflammation and they get better. It's inflammation of the cartilage. So likewise with the eye, during those 10 years in Phoenix, I was experimenting, trying to find out what frequency, and sometimes it was a surprise for me. And that's how I developed a lot of my protocols over the last 15 years.
In your perusal of the legacy articles from the ancients, from our ancients, did they have what we could today call materials and methods, or did you have to kind of read between the lines of what they were actually doing, electrically speaking?
I didn't understand the question.
I'm talking about the legacy bibliography, what you started with. Yeah.
Oh yeah, they gave instructions on how to place things and the current. Yeah, that's in the old literature.
They were specific about what they were. Did you have to kind of read between the lines to determine what the electrical parameters that they were actually using?
Not really. It was pretty crude and rudimentary instruments. It was just simple direct current, and they listed the frequencies and the current that was listed. There may not have been the accuracy that we have now. Their measuring devices were not that accurate. And they were actually, that wasn't microcurrent. It was, milliamps. It was a higher current.
And it was a strictly direct current.
Strictly direct current, yeah.
No fluctuation.
Yeah. All right, if there's no other questions, fantastic to be back. Good to meet all of you and hope to work with you in the future. And we'll talk to you later.
Any question from Zoom?
Yes, I have a question about can a patient with a pacemaker use these modalities, or is that too dangerous? I actually can't hear you. I can't hear you.
Can you hear me now?
Yes,
Hello?
thank you.
Early on in the FDA literature with the microcurrent, it was prohibited in using microcurrent with the pacemaker. I did have the patients sign a release from their cardiologist permitting me to use microcurrent early on. But right now, because the current is so low, and I've consulted with some of my cardiac colleagues, and they kind of snickered. They said, you know, the current's so low, it's not going to do anything. Plus now with the modern style pacemakers, it really should not be an issue. Now, if you wanted to protect yourself, you should have a release that the patient you take to their cardiologist to sign. But personally, I don't think it's an issue.
A question from Zoom said, do you use red light therapy? Red light?
Red light can be very beneficial for detoxing, but you have to be careful with certain eye diseases. Remember, red light is putting energy into the eye. If you have an inflammatory disease or wet macular degeneration, you want to be very careful with the red light because you're putting more inflammation in or more energy in, which is going to cause more inflammation. You want to use more of a blue spectrum to quiet the eye. That's why I like syntonic light therapy. Syntonic light therapy, we select certain light wavelengths specifically for the disease. In addition, a red light therapy can be very good for detoxing, but you have to be very careful putting it directly into the eye. Infrared, red light therapy, great for detoxing, but I would be cautious using it for the eye unless you're aware of a certain condition that red light would benefit the person, such as damage to the optic nerve, optic atrophy, death of the optic nerve, dry macular degeneration, degenerative diseases. Red light would be helpful, but inflammatory diseases, you have to be very, very careful. That's why it's important that you do obtain eye records. Maybe you work with an ophthalmologist or optometrist so you can understand what disease is going on. So there isn't a blanket treatment. It has to be selected based on what's going on with the patient.
Can you share a little bit about the neurologist treatment? In the video, she mentioned about only 3 days. She improved a lot. Is it a brief program or brief in multiple times in 3 days?
Well, when I was doing my week program, I was very aggressive. I wanted to find the right frequencies to make a difference with the patient. I had a unique opportunity. They were with me for 3 days, and I wanted to turn things around in 3 days. But now with the home program, we're using the same frequency parameters and we're getting the same results, but not everybody will get an increase like that in 3 days. Usually I like to start treating them for a couple of weeks to a month and then reevaluate what's going on after a couple of weeks to a month. Now, interestingly, sometimes the patient may not notice an improvement of vision, but they go back to their eye doctor and it's a dramatic improvement. Sometimes the visual change is slow. That's why you not only need subjective improvement, but you need objective. Now, that lady had a condition called uveitis, which I'm seeing more and more of. And it can be a devastating disease where you get marked inflammation inside the eye, and very destructive. I mean, it can lead to blindness over a couple of months. And unfortunately, the traditional treatment is very, very toxic. Methotrexate, a lot of these high potency anti-chemotherapeutic drugs that they have to take for their life, and a lot of different side effects. So I think that's where microcurrent and a lot of these modalities can be really, really helpful.
Yes, I have a question.
Sorry.
Oh, yes, so I have a question going back to the type of therapies for the eye involving light. So there are products now coming out that deliver specific frequencies through light. I think it's a laser light type. And I was just wondering whether you've explored that.
As I mentioned, I'm certified by the College of Syntonics. This is an organization that has used light therapy for over 100 years.
Okay.
Published data. It's, there's a lot of new modalities out there, new devices. I really can't comment. But the key is frequency. Also, the key is intensity. You don't want to have a really bright light. The syntonic light, we use a very, very low watt light bulb. It's a dim light. We want to gently stimulate the eye. Also, the other factor is the light going directly into the eye, or are you treating the light through the skin, of a closed eyelid? If it's going directly into the eye, you have to be very careful with what you're doing.
Yeah. All right. So the therapy you're mentioning then is frequency specific, syntonic?
Well, it's not really frequency specific. It's light wave specific.
Okay.
So we have different light wavelengths, that it's not frequency specific. And I really don't want to get into that because that's a subject of another talk. I could talk an hour about light therapy. This is focused on microcurrent.
Right. All right. Thank you so much.
I just have one last question. So I found a lot of chronic problem or a degenerative problem. I tend to run longer treatment because I believe this is like a stem cell or regenerative. Do you see benefit or disadvantage running eye program longer in your
I
cases?
used to run eye programs for an hour, hour and a half. And the danger is we want to gently stimulate. So a little, the Arnold Schultz law, a little stimulates, too much will suppress. And it's our nature. We want to put more energy. We want to do it longer. And to me, that is counterproductive to the healing. Sometimes when you have a degenerative state, you have to be very careful because the vital force is weak. You want to even use less therapy. You want to gently stimulate them. So if somebody has a low vital force, is disabled, very weak, I think it's a misconception to think you need longer treatments. That can be more detrimental to them because their body doesn't have any energy to heal. Remember, we're stimulating the natural healing ability. It's not like microcurrent is taking over the body. We're stimulating the function of the body to heal itself. It's not like the patient becomes dependent on microcurrent. We're stimulating the body to regain its own natural healing function.
One question, Zoom, follow up with the PEMF on head. Do you think PEMF is dangerous to be placed near the head, or would it be fine if not running eye frequencies?
I don't like the PEMF near the head, mainly because I commented earlier, we don't know the intensity. I know when early on, I experimented with about a dozen different PEMF devices. I think they're very good for the body. They're good for musculoskeletal problems. But in my experience, when you start using them to treat the eye, I've seen elevated pressures and I've seen decrease in vision. Not permanent damage, but it has been alarming to the patient to have a decrease in vision.
The other question, follow up with the right light. Is right light therapy contraindicated in glaucoma as well?
That depends on the type of glaucoma. Sometimes if you have a lot of optic nerve damage, you do want to use red light to give more energy to the eye. But if there's an inflammatory component, you have to be careful. The problem with red light is too strong. In syntonic light therapy, usually we begin with a combination of red and green or lemon. So lemon is a color that has a slight red tone. Remember, we want to gently stimulate the body. Sometimes if you go in with a sledgehammer, you're going to cause a lot of damage. The eye, remember, is a very sensitive tissue. It's not like treating your knee or a muscle in your body. The retina tissue and the neurological tissue is very sensitive. We want to be gentle. And typically in syntonics, we don't jump to red light. We never do. Usually, if you feel that the person needs some more energy, we use a combination of red and green. It's called mu delta. It looks like lemon. It's just slightly on the red tone. You may want to investigate. You could go to the College of Syntonics. They have an annual meeting, which is a great meeting, and they do train lay practitioners on light therapy.
Any other question from online?
A question?
Thank you for the great talk. I had a question on the delivery mechanism. Why you use the glove within the towel? Does it improve diffusion of the energy within the, why not just use the towels themselves? And also, have you had an experience with the electrodes, and do you like the electrodes?
Well, the first question is, I like to wrap the gloves in a washcloth because it kind of protects and increases the longevity of the gloves. You know, you could theoretically put the glove on your eye, but oils from the skin and other matters going to accumulate. So I like to wrap them in a washcloth. The washcloth should be, you know, soaked in water. They should be moist to improve the conduction. Also, many of my patients, and we have somebody with essential oils, I love essential oils. In fact, a lot of my patients, what we do is I tell them to put a couple of drops of frankincense oil in the water and soak the washcloth there. Frankincense oil has amazing regenerative properties, and microcurrent is a carrier. It carries the energy into the eye. So the combination of frankincense in the water that you soak the washcloth is really good. Electrodes work. I don't recommend them on the eye, but I use electrodes in other body treatments, you know, for musculoskeletal problems. And many of my patients, when they're doing long-term treatments for detox or back pain, will use electrodes. But for the eye, I like the washcloth. I've used the electroconductive gloves or glasses, but the problem with the glasses is that it's on the orbital rim. It doesn't go transpalpebral. So the washcloth, and it's simple. And well, how are you going to get the current to the washcloth? No, it's not going to work. First of all, water has varying conductivity. And the silver impregnated gloves have a very, very high conductivity and gets a nice distribution. I don't think putting an alligator clip, you're not going to get an effective treatment.
I can add a little bit of comments on your question. That's really a question from other people. Use silver mesh gloves with a washcloth versus just the washcloths alone. One doctor in Florida did an experiment on their patients just to use gloves with washcloths versus doing like a controlled study. And then you obviously find that the response from patient who use the gloves with washcloths is better than just the washcloth itself. So yeah, he called me and asked me the question, what might be the reason from the engineering point of view? I think one reason could be because our silver mesh glove has a layer, a net of the silver metals. So when you have the silver mesh gloves, that's a kind of a layer of metal. That can also create, besides the current, also create some like electrical magnetic field that can be helpful. I don't have further explanation. That's only from engineering point of view, a little different. Dr. Kondrot has a point that conductivity could be another thing.
Yeah, if you have distilled water, you're not going to have any conductivity. So it depends on the solute in the water. But Ning made a good point. Anytime current flows through a wire, you produce a pulse electromagnetic field. So in a way, when you are getting a mild pulse electromagnetic field, right?
So just a couple of comments on two things. So one, around the electrode, I think it's a great conversation. I mean, there's an entire science that's just dedicated to the study of how current moves from an electrode into the body. And it's incredibly complex, and nobody has found the answer yet, right? So it really, you solve one thing, you create another, you solve that one, you create another. So it's an incredibly complex physics of just getting electricity into the body. So I would just say, keep noodling and trying and like that, right? And Yeah. So, and then on the light conversation, I think it would be a great conversation to have. I'll talk a lot about it in my presentation, but I just wanted to say, anybody who's interested in this, if you look at Boston Mass General, their grand rounds for photobiomodulation, they do a fantastic job. They do about a talk a month where they bring together some of the top researchers around the world and clinicians and device manufacturers. So in one talk, you might have 80 or 90 of the top minds studying this every day. And they'll talk you through like a lot of the questions that came up. You'll find, direct research talking about red light, near infrared light, used varyingly in the body in different ways, pulse, continuous. It's a treasure trove of information because it's rare to find researchers, clinicians, and device manufacturers all in the same conversation. So great place to learn.
So if you're only using one towel, how are the frequencies getting into the tissue? Because wouldn't the current just stay within the towel itself?
Oh, no, we put a glove wrapped in a washcloth over the eyes and one in the back of the neck.
Okay, perfect.
Back of the neck. Good point for clarification.
So glove and the washcloth back?
No, gloves and the washcloth. Remember the imaginary point I talked about. I always draw an imaginary line from one washcloth or glove to the other. So you have it here, back of the neck, the imaginary line is going through the eye. So that's the transpalpebral treatment approach. That's a very good question. It doesn't matter.
Doesn't matter.
Because we're alternating. It's going from A to B, then B to A. Now, I did experiment. I tried to do it unidirectional. I thought maybe would get better results. And I ran a whole series traveling in one direction and didn't make any difference. Yeah.
Electrically speaking, would the washcloth provide any impedance increase and lower the current? Yes.
What is the question?
The washcloth, does that add more of an impedance resistance to the?
Yeah, you are, but I think it's minimal. If they're moistened, it's going to be very minimal.
It's not dropping the microcurrent level.
Well, no, I mean, we're getting feedback. It's a closed circuit, so we know the current's going through the body. Remember, it's a current constant machine. Doesn't matter what the impedance is, we're still delivering that current specifically to the eye, whether the washcloth is a millimeter or an inch thick. If it's dry and it's an inch thick, you're not going to get any current, and the indicator lights will come on in the machine. It's not going to affect the treatment because the current's going to be delivered because it's a current constant machine.
Any other questions? Got just about 5 more. Are we good? We'll go to break. So thank you, Dr.
Yeah,
Kondrot,
sorry.
for all of that amazing
Can I ask a
information.
question?
There are few people in the world that have done what he has done, right? So it's pretty fascinating. So I neglected a few little details that I usually am pretty good at.